These are the 4 mattress sutures I use most often. You probably don't know all of them. This is how I do them in the operating room, and why. The everting suture, aka the horizontal mattress. I do this to lift up depressed skin edges. Pay close attention. Retrieve the needle with the forceps, then extend your wrist to show yourself the body of the needle holder. You can now mount the needle holder to suture in reverse. The third bite is next to the second exit point, and you finish next to your first entry point. I often lift the loop out of the skin before I tie the knot, as it is this loop that brings the edge towards the other. If the suture loop sinks into the skin too early, the closure may not be at the right tension. The edges are either not completely together or come apart when you let go of the suture after tying the knot. When you need to bring a gaping wound together, even if it's just temporary to close a big wound, such as the donor site for a large skin graft or a flap, try the locking mattress, aka the summer lad suture. It starts like a horizontal mattress, with a small modification at the end that reduces the risk of skin edge necrosis. Before tying the knot, pass the needle and the long length of suture through the loop. This keeps the loop out of the skin, and for a wound under tension, distributes it over a wider area of suture above the skin. It's not as attractive as a horizontal mattress, but it does the job. So you go across the wound and then come back next to your last 2 sutures. This is the same as a horizontal mattress. Before tying the knot, pass the needle through the loop and then tie your surgeon's knot, followed by 2 reef knots. You cannot learn the horizontal mattress and ignore the vertical mattress. For this, you go across the wound, but return just in front of the previous 2 bites. This is different to the horizontal mattress, where you return next to the first 2 bites. I only really use this to achieve eversion in a small wound, or to correct a rolled in skin edge in one I have already closed. Economy of movement and reducing repetitive maneuvers is important in suturing fast. Watch this technique again, but focus on the movements of my hands, how I handle the needle holder, and how I handle the suture needle in anticipation of my next maneuver, to limit maneuvers that add nothing but time. Now this is the most elegant suture of them all, the half-buried corner suture. A 3-point suture that brings in a skin flap neatly and also avoids visible suture on the skin flap. It starts like the rest from outside to in, but your next bite is intradermal and completely horizontal. You do not want to see this suture from on top, coming through the epidermis. You finish by coming from inside to out next to where you started. Now watch the edges draw closed as you tie off with knots, the usual surgeon's knot followed by 2 reef knots.